CNN's chief medical correspondent, Dr. Sanjay Gupta, going one-on-one with Joe Rogan. Now, Joe Rogan, of course, is the controversial podcast host who tested positive for COVID, took unproven treatments for the virus, and has repeatedly raised doubts about the vaccine and criticized vaccines. Here is a bit of what Rogan has said in the past.
If you're like 21 years old and you say to me, should I get vaccinated? I go, no. If you're a healthy person and you're exercising all the time and you're young and you're eating well, and like, I don't think you need to worry about this. All you hear is take this vaccine that doesn't even prevent you from getting the disease, or you can't go to the sauna or where the fuck you want to go. You can't go to the Broadway show. It's madness.
Well, in a new podcast out today, Sanjay asked Rogan about getting vaccinated. And here's that exchange.
So would you now, with what you know now, and having had COVID, would you have wished that you had been vaccinated?
No.
Beforehand?
But I got
You almost
through
got
it.
vaccinated.
Yeah, but again, I explained all that.
You got through it.
But I got through COVID.
Yeah.
Pretty quickly.
Yeah.
So that was my thought was, I'm a healthy person. I exercise constantly. I'm always taking vitamins. I take care of myself. I felt like I was going to be okay, and that was true. It was correct. I'm happy. I got through it. I don't wish it upon anyone. It wasn't fun, but it wasn't the worst cold I've ever had, and I got over it fairly quickly, relatively speaking.
I think that, and again, I am truly glad about that. I'm not, all kidding aside, I don't think anybody wishes you, everybody wants you to be well and healthy. But I think the question is just in terms of the nuance of this. It's not a strategy to recommend people get infected.
I'm not recommending anybody get infected.
So they should get vaccinated.
I think a lot of people should get vaccinated.
You're talking,
I think
a lot of vulnerable people.
Yeah.
If you just said vulnerable people, there'd be a lot
older
of
people, fat people, I think a lot of those folks. My real concern is this urge to vaccinate children. And I don't know what kind of data we have on the long-term effects of this, and I don't know what kind of data when you look at this study that shows that the 12 to 15-year-old boys are 4 to 6 times more likely, or what is that the number? Was that whatever the number was? Much more likely. That scares out of me.
Thankfully, it's really small numbers, period.
Right, period.
All right, Sanjay is with me now, and Sanjay, of course, is also the author of the new book, World War C, Lessons from the COVID-19 Pandemic and How to Prepare for the Next One. So, Sanjay, look, I think this is really important because Joe Rogan is listened to and popular with a lot of people who aren't consuming mainstream media and mainstream science, right? So you went on there, I know, to talk to him, yes, and to talk to people who listen to him. You talked to him for more than 3 hours. So what was the main reason that you made the decision to do that?
Yeah, I think it's exactly that, Aaron. I mean, it's this idea that, you know, we've been at this for a couple of years now. I think we talk about this obviously on your program, on CNN, all the time. But there's a lot of people who still aren't getting the message. And I don't know, maybe it was a silly idea of mine, but I wanted to go talk. I think if you're serious about public health, you've got to go reach people who aren't typically hearing these messages. And I think it's Joe. I also felt that Joe was willing to have a dialogue. I mean, we had talked on the phone a couple of times. He wanted to have this conversation. So I thought there was room for a real dialogue out of which maybe some new knowledge for his listeners could come.
So I played part of the vaccination conversation, but as I said, it was 3 hours. So it wasn't the only time you tried to convince Rogan to get vaccinated. I wanted to play another instance during an exchange that you had when you guys were talking about immunity to COVID.
Testing is obviously testing you to see if you have the virus.
Yes.
The therapeutic is to treat you because you have the virus.
Yes.
I still think it'd be better not to get the virus.
I think it'd be better to get the virus and recover and have amazing immunity to it.
What, like,
wouldn't it be?
Well, you could get sick, though.
You know what I think you should do? I think you should get vaccinated and then get sick.
What?
This is why. Because then you got the vaccine protects you from a bad infection, and then you get COVID, so then you get the robust immunity that's imparted from having the actual disease itself, which is far more complex and comprehensive than you're getting from the vaccine that targets one specific protein, right?
You could make that argument, I think.
Yeah, so that's the move. You get vaccinated, let it wane, and hang around with a bunch of dirty people.
Okay, well, and
then get a lot of therapeutics on hand so you can take care of it quickly.
I will see your recommendation.
And do it?
And give you a recommendation.
Should have come out with us last night. You probably would have caught it.
I almost did. Yeah. Now I know what your secret plan was. No. So for you, Joe Rogan.
Yes.
I would say you've had it.
Yes.
So now get one shot of the vaccine.
No.
Why not?
Because I have better immunity than I would if I was vaccinated.
Okay, so Sanjay, I mean, as many times you try to explain that, I mean, the obvious things of nobody knows how long that natural immunity lasts or how it differs from person to person. And of course, it would only be better if you had the vaccine on top of it, all of these basic facts. Do you feel like you broke through or that he will ever embrace the vaccine?
I don't think so. I mean, I hate to say that, but he just was very steadfast in this. And when I cited him data saying, hey, look, there is the people who have natural immunity, people who have vaccinated immunity, and while the natural immunity may be strong for a period of time, reinfection rates are twice as high among people who have natural immunity versus vaccinated immunity. All this data, and he didn't dismiss the data, but that's I think the thing that sort of surprised me the most is that I think when you're convincing yourself of a particular narrative, in this case, no vaccine, you find whatever sort of argument you can to support that.
Yeah.
So there was a study that came out of Israel showing at least for a period of time people do have strong immunity from natural immunity, but the idea of how long it lasts, the idea of what the reinfection rates are, I just think that he didn't want to hear that. And you could hear he was kind of jokey about it, Aaron. He was suggesting, instead of him going and getting a vaccine, that I should go get COVID. I'm pretty sure he was joking about that, but you could sort of see what I was dealing with there.